Hey everyone, welcome back to the channel. I'm Nairicos TV, and today, we're talking about an important topic for pig farmers and animal health fans: pigs' digestive diseases and disorders. Pigs are smart animals, but their digestive system can face issues that impact their health and a farmer's operation. We'll cover common digestive problems, how they affect pigs' growth and well-being, and tips on prevention and treatment. Stick around if you're interested in keeping your pigs healthy and happy. Let's get started. Scouring. Hygienic measures should be taken to avoid or minimize scouring incidents. Regular deworming should also be done as a control measure to scouring. Feed changes should be gradual and not drastic to avoid scouring. Birth diarrhea. Symptoms. Acute diarrhea in piglets is watery, yellowish-gray, and within a very short time piglets become thin with sunken eyes due to dehydration. Death can occur within 2 to 3 days. Death in piglets can occur even within 1 day before any sign of diarrhea is observed. Prevention. Keep pens, feed and watering troughs clean. Separate affected animals from healthy animals. Do not change abruptly an animal's ration. Make sure that piglets have sufficient colostrum within 36 hours of birth. Treatment. Vaccination. Plenty of drinking water with electrolytes. Use of antibiotics. Herbal medicine, fresh leaves of guava or star apple. This will treat the symptoms only. Red diarrhea or clostridial enteritis. Symptoms. Acute hemorrhagic or necrotic inflammation of the gut during the first and second week of birth. In acute cases, the diarrhea is watery with an orange-red color due to blood, and it's often bubbly. In later stages, shreds of dead tissues can be found. Piglets are weak and don't suckle. They get pale and die within a few days. Prevention and treatment. Vaccination. Make sure that piglets have sufficient colostrums within 36 hours of birth. Keep the pigs warm. Cleanliness. Contact the veterinary. Transmissible gastroenteritis. Transmissible gastroenteritis is a common viral disease of the small intestine that causes vomiting and profuse diarrhea in pigs of all ages. It spreads rapidly. Piglets less than 1 week old rarely survive the disease. Symptoms. Very high mortality, mainly in piglets up to 14 days old. The piglets often vomit and have severe greenish-yellow watery diarrhea, dehydration. In sows the diarrhea is grayish, they vomit, abortion may occur. In fatteners the symptoms are like those in sows. Prevention and treatment. Give electrolytes to piglets and keep them warm. Antibiotics prevent secondary infection but don't provide a cure. Fat diarrhea. Symptoms. Feces are pasty and fatty, white or yellowish. Prevention and treatment. Remove creep feed for a few days. Use antibiotics as prescribed by a veterinary doctor. Post-diarrhea. Symptoms. Diarrhea with no traces of blood. Death from dehydration or blood poisoning, septicemia. Prevention and treatment. Increase creep feed before weaning. Avoid stress to piglets by not mixing piglets from different litters. Good hygienic measures include roughage in diet. Use antibiotics as prescribed by a veterinary doctor. Salmonellosis. Symptoms. High fever, dullness, anorexia, weakness, nervous symptoms. Bluish-red coloring of the ears, limbs, and the center of the belly. Bloody spots all over the body. Wasting and persistent grayish diarrhea, sometimes mixed with blood and shreds or necrotic material from the gut. Prevention and treatment. Normal hygienic measures: pelleted feed, thorough cooking of the swill. Remove feed for 2 days and provide clean water. Use antibiotics as prescribed by a veterinary doctor. Swine dysentery. Known by a number of names, including bloody diarrhea, hemorrhagic enteritis, bloody scours, and black scours. It affects pigs of all ages, sometimes causing death. Symptoms. In acute cases, wasting and passing of diarrhea containing varying amounts of mucus, blood and necrotic material. Fever. In chronic cases, pigs have grayish or brownish feces, rough hair coat and low growth rate. Prevention and treatment. Delay reusing the pens of infected animals. Disinfect pens. Some herbal medicines, moringa tree leaves, can be used to relieve the symptoms of diarrhea and dehydration. Use antibiotics as prescribed by a veterinary doctor.
Post-weaning syndrome or oedema disease. Symptoms. Development of oedema and nervous signs. Paliness, peculiar squeaky voice. General incoordination and loss of balance. Sudden death. Prevention and treatment. Affected piglets should be weaned via removal of sow and placed on low-level diet. Avoid stress. Hygiene. Include rohages in diet. Use antibiotics as prescribed by veterinary doctor.
That's a wrap on today's look at pigs' digestive health. I hope you found the info useful and now have a better understanding of common digestive issues and how to manage them. Remember, quick action at the first sign of trouble is key to preventing bigger problems down the road. If you're passionate about animal welfare, staying proactive is the way to go. If you liked the video, hit like, subscribe for more tips, and feel free to share your thoughts or questions in the comments below. Thanks for watching, and I'll see you next time with more ways to keep your animals healthy. Take care.